to what you would see with a human. All right. So I've got two up here. This one, the pericardial sac has already been removed. The one that you have in front of you has the pericardial sac on it. When they prepare these, it kind of like, look, it looks like it's shrink wrapped, right? That pericardial sac is really suctioned up against the heart. But if you kind of start to pull it off a little bit, you should be able to find somewhere that you can cut into it. All right, and once you cut it, you should be able to pretty easily pull it off from the heart. You can use your scalpel, or you can use scissors.
Do you mind opening?
No, so.
This is not part of it, is it? No, maybe don't brush.
Once you guys all have it off, we'll take a second and kind of, there's a few things that I want to point out.
She cut off the top. Okay, wait, no. Yeah, no, part of it. Part of it.
I know.
Like this part? I don't know. Do you take off the squishy yellow?
It's okay. There's some fat at the top, kind of cushioning things and filling in spaces. That's what that yellow is. It's okay. You can leave that.
So we were just supposed to peel off the ventricle parts, not the...
No, you can like cut it off, cut the pericardium off at the top, but don't like try and, you don't have to try and trim up all the little fat in between. All right, have we all taken off the pericardial sac?
Yeah.
Okay.
Should I throw the gloves away, right? That would be good.
That's okay. No, that's fine. I mean, up here, this is just.
Yeah. Yours, you brought it to me. Yeah, we didn't. No, we didn't.
Yeah.
Because I want to feel how.
All right, guys. All right, so there's a few things that I want to kind of point out before we start to make our way down the list. First, this pericardial sac, right, that completely surrounds the heart. Notice it's not elastic, right? It's a strong fibrous sac. It is not elastic. That becomes really important if we have patients who have infections around the heart, because think of an infection anywhere else. You start to get fluid accumulating, pus can accumulate, right? And as fluid accumulates in that pericardial cavity, that space, the sac can't stretch. That fluid has nowhere to go, so it starts to squeeze in and compress the heart. That's called cardiac tamponade, but that becomes very problematic for the heart because this is not elastic and doesn't stretch. You can notice though how nice and slippery and slimy the inside of that is. Right, that's the parietal pericardium. And then if you notice your heart itself, right, if you rub the surface of your heart, it's glossy, right? It's nice and it's slippery. That's the visceral pericardium, right? Or what's the other word for visceral pericardium? Good, epicardium. So that epicardium is what's making the surface of the heart feel so slippery. That way these two layers, right, will slide and glide alongside each other instead of generating friction as the heart moves. The epicardium doesn't come off, right? Notice there's nothing more for us to pull off. It's attached to the heart, part of the heart. Just in general, I told you guys you'd probably be pretty surprised when you see how much bigger the ventricles are, that they take up pretty much the whole heart. This is the right atrium. This is the left atrium, right here. Sorry. Like this, that's it. All of this is the ventricle, right? All of this is ventricle. So the atria, right, are tiny little chambers up top. You can see there's like the little auricle, the little flap that hangs over the ventricle. Oh, I didn't have you guys orient your heart. You have to be looking at the front of your heart. So the way that I always find the front of my heart is by looking for the pulmonary trunk. The pulmonary trunk, remember that on the model it's blue, it curves like this to go to the right ventricle. And the front of the heart is just more clean looking. When you look at the back, right, there's a bunch of pulmonary veins coming in and out. The back looks much messier. The front has a much more clean appearance and has the pulmonary trunk. Can you guys find the front from the back?
Yeah.
Everybody can find the front? Good? Okay, all right guys. You guys will be able, guys, you guys will be able to all look at it individually afterwards, but I don't want to have to like holler over top of you. So, guys, if you found the front, you should be able to look at it then and decide, first off, right from left is the opposite of you, right? So this would be my right, this would be my left. You can say this is the right atrium and the right ventricle. The left atrium and the left ventricle. When we look at the atria, remember they have the auricle, right? This little like bumpy flap that's hanging over the side is the auricle. Same thing over here on the left. You notice the little bumpy flap that hangs over? That's the auricle. When we're looking at the heart like this, like the way I was able to tell the right ventricle from the left ventricle is, remember, there's the anterior interventricular sulcus. It's not a really deep groove on here, but notice these blood vessels. You can see the small little coronary vessels traveling down the front, and you can see there's like a little bit of fat kind of padding them, a little bit of that yellow padding. So that's telling me where the line is between my ventricles so that I can identify the right ventricle versus the left ventricle. Is everybody okay with that part before? Yeah? Okay, so I do want to show you, guys the difference between an artery and a vein before we move on. We talk about this a lot in lecture, especially in like the next section when we get to blood vessels. But the structure of the artery wall is very different from the structure of the veins wall. Arteries have much thicker, stronger walls, right? Why would that be? Because there's higher pressure, right? Remember that your blood pressure, right? Most of that pressure is coming from the force of the heart. So the heart contracts with a bunch of force and pushes blood out into the vessels. That blood's going into arteries. And as those arteries branch out into the body, pressure's going down, 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 down. Then the blood goes through the capillaries, right? Then we get to the veins. We've lost most of the pressure, right? Then blood goes through all of the veins, and there's almost no pressure left. It's like 1 millimeter of mercury left when we get back to the heart. So the pressure in the arteries, the blood pushing out on the walls, it's so much higher in the arteries versus in the veins. So the arteries have to be stronger, right? The walls have to be able to hold up against that. And we can see that. If you are, it's kind of hard to find the veins on here because of the way that they prepare these hearts. Normally you can very nicely see like the superior vena cava and inferior vena cava. They're like part of the pericardial sac. They get enclosed in the pericardial sac. But with these hearts, it's a little bit difficult to see them or to find them. And because these are small, it's a little bit hard. But I found this right here is the superior vena cava coming into the top of my right atrium. And if you look at the walls of it, right, see how thin those walls are? If you notice, it just completely collapses on me. If you look, again, unfortunately, they completely destroyed this aorta. But if you look at the walls of the aorta, much stronger, right? Those vessels are comparable with each other, the aorta and the vena cava, right? They're like the largest vein versus largest artery. But the aorta has much stronger walls because it's an artery. This is one of the hearts we had last time. This is better at letting us see the vena cava. Right here, this is the inferior vena cava. Like, it's collapsed, there's nothing in it, but that's the inferior vena cava. Compared to, again, if you look up here, like these are the walls of one of the arteries. Much thicker and stronger, right? Okay, so from the outside of the heart, again, you guys will need to identify the chambers, we did that. The auricles, we did that. The sulcus, we did that. Also, you guys will need to identify the pulmonary trunk and the aorta. What I ask for on the test kind of depends on how nice the heart is that I have. Right? Some hearts will have a beautiful aorta where you have this nice curve up here and you see 3 branches coming off of it and it's gorgeous. This does not. Right? In this case, the aorta has been cut, it's kind of destroyed. Like, this is a terrible example of an aorta. So I wouldn't ask you for the aorta, but the pulmonary trunk is nice. Right? The pulmonary trunk, if you picture the model, remember that blue that curves along the front? So this right here is the pulmonary trunk. For the vessels, if you're not sure what it is, you can put your finger in it, and that kind of straightens it out a bit, and you can see where it goes, right? This is going to the right ventricle, which we know the pulmonary trunk does. All right, so now what we're gonna do is cut into our heart, right? You guys are gonna cut it completely in half, right? Like a bagel. Don't do it against your hand though. But use your, but you're never gonna look at a bagel the same. Cut it completely in half. Like this. Front from back. It's tough. Yeah, you might have to like share knives with someone. These knives are bad, but those are really bad.
Is it hard? No. I'm gonna use a scalpel. I don't think it's gonna work. The scalpel. No, the scalpel is much just like push it. Oh my god. She's really good. Yeah. Oh, she's like a scalp.
She helped me, like she was holding it and then I like let it go. Do you want to take it?
We have to change this. I feel like it doesn't work.
Oh, so is that this would be the ascending aorta then, wouldn't that be?
I'm gonna go along this.
Oh wow. Look at there. Is it the, no, it's not the tricuspid here. It's the papillary.
Alrighty guys, so you've got it open, everybody's cut it?
No.
Hey, let somebody, does anybody have a knife that actually cuts better than that?
Oh yeah. It's so big.
Sorry, we could do a massive butter knife.
Oh yeah, was there? Yeah, I don't know.
All right.
So you're telling me the last time you did that, you cut it the opposite way?
Hey.
All right, so first off, when you're looking at it, guys, it's gonna be really confusing if you take the front of it that you cut off and flip it and look at it. Because then the left and the right are gonna be matching your left and right, and it's gonna get really confusing. So make sure, right, this was the heart, this is the front of the heart. I'm gonna take the front of the heart off and put that aside. So that we're looking into the heart, right? We're looking directly at the heart. So this is the left, this is the right. Okay, left ventricle, right ventricle. Is everybody good with that? No, it's okay, it's just where you cut it. And this is just full of blood. That's, yeah, so it's just where, where it was cut, but that's all.
We're not sure like which one is
This is the front, so just put that aside.
so this would just be the left or the right?
Yep. All right, guys, so looking at the heart like this, right? Again, before we get into the stuff on the board that you guys need to know for the test, I want to take a second to just kind of point out a couple things that that display the physiology that we're learning about, right? Remember, we have two pairs of valves. We've got the atrioventricular valves. I've got those written on the board. Those are things you should be able to identify. The bicuspid and tricuspid. But notice I don't have you identifying the pulmonary valve or the aortic valve, right? Those are much more delicate valves. Think about why they're more delicate, right? Why do the semilunar valves, right, the aortic and pulmonary valve, how come they don't have papillary muscles attached, right? Why is it that they don't have chordae tendineae attached? Because they don't need them. They don't have to be as strong as the AV valves are. Because think about what they have to hold up against, right? The atrioventricular valves have to be strong enough so that when the ventricles contract, they go up and hold strong. We don't want them to fly back up into the atria. they have to hold up against the force of the ventricles. That's like the strongest force that we have in the whole circulatory system, right? The AV valves, so what we're looking at right here, guys, like this right here is leading out of, it looks like that's coming over to lead out of the left ventricle. So the aorta comes up like this. So at the bottom of the aorta, the aortic valve. When the ventricle contracts, that's open. So it closes when the ventricle relaxes. All it has to hold up against is the blood dropping down backwards. That's it. Like, that's not nearly as much force. So it doesn't need to be as strong. As a result, when we look at it, it's harder to kind of see it and visualize it because it's so much more delicate. Do you see those little flaps, those little cups in there? Yeah. There's 3 of those little cups that come together, right? These right here, there's one. So let me see if I can get my finger in it. Can you guys actually see them, like right there? They're really thin, delicate little structures sticking out there. There's 3 of those little cups. They're like the size of the tip of your pointer finger. And when the blood drips down backwards, like my finger is sliding down, right, like the blood would slide down, it fills up that cup. And if you fill up all 3 of those cups, right, they're gonna all meet each other in the middle and completely block that vessel off. But notice how delicate that valve is, right? That is very different from what we're gonna see with the AV valves. And again, it's just because of pressure. Just like the difference in the artery and the vein, it's because of pressure. All right, so let's go ahead and start to work our way through the structures that we have to identify. Let's start with the layers of the heart wall. Let's start with the layers of the heart wall because this is a really, really great way for us to see how important the like the visceral pericardium and the endocardium are to decrease friction. So first off, remember that most of the heart wall is made of muscle, right? The myocardium. So when you look here, all of this, right, all of this, that's muscle. Again, that would be called the myocardium. Go ahead and feel it. It's rough. Right? It is bumpy. It's kind of like steak. If you were to, I am hungry or something. I keep mentioning food. I ruined bagels. Now I've ruined steak. I don't know what else I can think of. Okay, but it's rough, right? Like it's bumpy. So if you can imagine that rubbing up against something else that's rough and bumpy, that's going to generate a lot of friction. If you feel the outside of the heart, that is very slippery. Because again, that's where the epicardium is. The inside of the heart is also like that. You can see it, right? If you look inside the ventricle, that is really slimy and slippery again, right? Same thing over here. This is slimy and slippery, because the inside of the heart is lined with the endocardium, right? So the way that you guys would see questions like that on the test is I could put a pin outside like this and say identify the layer of the heart wall. What would that be? Epicardium. If I put it like this and I said identify the layer of the heart wall. Excellent. If I put it on the inside and I said identify the layer of the heart wall. Endocardium. Excellent. Something else that you can kind of see right here that's very neat. Look at the difference in the myocardium, right, in each of the chambers. All 4 chambers have a myocardium, right? All 4 chambers have a layer of muscle, but it's very different thickness in each chamber. Up in the atria, the myocardium is pretty thin. Down in the ventricles, it's much thicker. But even comparing the right ventricle and left ventricle, you can see how different it is. Right? The right ventricle does not have nearly as much muscle as we see in the left ventricle. Right? They are very different from each other because the left ventricle, remember, has to be much stronger. This wall right here right, is separating the ventricles from each other. That's our interventricular septum, right? Interventricular septum. So if I were to put the pin in here and I were to say identify the structure, in parentheses I would probably say not the layer, right? Like identify this structure. That structure is the interventricular septum. I could also ask you what layer is that, which is what? The myocardium, right? But the structure is the interventricular septum, right? The wall between the ventricles. Okay, now remember we said that there are muscular ridges inside the atria, and there are muscular ridges inside the ventricles. And we name those differently, right? So first off, on your heart, you should be able to, on one side or the other, kind of look up inside your atrium and see what the inside of it looks like. Right. Those are the pectinate muscles. Can you guys see the branching, like these muscular ridges?
Yeah.
Good. Can you guys all see pectinate muscles? Right. And you guys recognize what they look like. So if I have, which one showed this? Showed them really well. If I have the atria open and I'm pointing in like this, and I say identify the muscular ridges, what would you say? Pectinate muscles. We also have muscular ridges down in the ventricle, right? It's usually easiest to see them inside your right ventricle. If you kind of pull it back a little like that so you can really look inside. See those little ridges down here? Those are trabeculae carnae. You guys all can see them down here? I'm sure you can feel them. Right, you can also see some of them right here. That branching, those are trabeculae carnae.
So, for the exam, how would you have those shown? Because they're a little bit hard to see, and it's not like we can really touch them during.
Yeah, I wouldn't ask unless I have like it cut in a way that you can actually see them.
Okay. So we don't have to touch it.
Yeah, no, you're not gonna touch it at all. No, you're not gonna touch it. We have like multiple hearts over there that we save because one will show something really, really well. It just kind of depends on the shape of the heart, where the cut goes through. But yeah, you will not be touching it at all.
Is it gonna be like this kind of stuff on the exam? Like this, like real? Is it gonna be?
Yep. There will be, yeah, you guys, there are going to be 6 questions on the test that are from the real heart, right? That's why I wrote these things on the board. These are the things that I could ask you from the real heart. Okay, the last couple things that we need to look at have to do with the atrioventricular valves. So first, let's kind of like orient ourselves. Over here on the left side of the heart, this up here is the atrium. And then you can see there's an opening right here where you go down from the atrium into the ventricle. Remember, the atrioventricular valves guard that opening. So there are going to be little flaps of tissue, right, like this right here. There are little flaps of tissue like this that go down into that opening to guard the opening. That, along with the cords, the little strings, that's the valve. So for example, if I put a pin like this, and I say identify the valve, well, that's clearly an atrioventricular valve. It's on the left side. So you could say left atrioventricular valve, or you could say what? Bicuspid valve. Perfect. Or mitral valve. Right? On this heart, it's a little bit harder to see the right one. It's down in here. If I open it up a little bit, you can kind of see some of those flaps in the strings right here. But remember that the question is going to tell you a lot about what I'm asking. If I say valve, then I want you to either say right, bicuspid or tricuspid, depending on what side it's on. I could also ask you to identify the chordae tendineae or the papillary muscles. This one actually has a beautiful example of a papillary muscle. If you look here on the right side, that muscle that's sticking out right there, that's a papillary muscle. And I can actually, like if I touch it, if I pull it out, see, you can see how the strings are going directly into it. Right? Remember, that's what the papillary muscle is. It's a muscle that anchors the string. So if I had the pin like that, and I said identify the structure, that would be a papillary muscle. And then again, the cords themselves, right, the little strings themselves, I would just kind of come under like this and just say, you know, I'll literally say the strings, right, for chordae tendineae. All right, any questions about anything on the board? Any of the structures that we looked at?
No. You can say tendinous cord, right?
Yes. Yes, you could say tendinous cords or chordae tendineae, either is okay.
The trabecular, how do you pronounce
Trabeculae carnae,
it? Is it the string or is it an
No.
actual? Okay, so it's
No.
actually the muscle.
the muscular, the actual, like, see those ridges of
Yeah.
muscle?
Yeah.
The actual ridges of muscle, yeah, or the trabeculae carnae. So up in the atria, there are pectinate muscles. Down in the ventricles, they're trabeculae carnae.
How would you show the bicuspid? Oh, just the back.
Just,
Okay.
yeah, just stick it through the flap and say identify the valve.
Okay.
Yeah. All right, guys. So if you want to take a few minutes to kind of explore with the heart, you're welcome to do that. Whenever you're done, hey, give me 1 sec, guys. Guys, just listen for 1 more second so you know what to do when you're done, and then you guys can explore. When you're done, the heart, the pericardium, and your gloves all go here in the biohazard box. Your scalpel will go in the sharps box, and then the rest of the stuff, so the blue tray, the blue pad, the tray, your knife, if you have scissors, the rest of that stuff, wash in one of the sinks, and then lay it out to dry, okay? And then spray down, there's disinfectant on your table, so just spray down your table and wipe it down. Okay, that's it.